I'm Dr. Gavin McCall, GP and partner with the Hurley Group. I'm the Clinical Director of Southwark PCN and the Clinical Lead for the Covid-19 Community Clinic for South Southwark, based here at the Lister Primary Care Centre. In this video, I'm just going to give a brief overview of the basic principles of working at this service. So when staff arrive, if they get by car, they can park on this side of the car park here, or there's a bike facility here for bike bicycles. This entrance here is a clearly marked staff entrance. Arrival, upstairs there's a supply of clean laundry scrubs which staff will change into, and at the end of the session there's a shower facility which we recommend staff use. The building's been split into two zones. This is the blue zone here, and then the red zone on this side of the building here. So when patients have been triaged by their own GP, they are booked onto the clinical system, where the clinical team can perform a double triage with access to the full medical records. Once the patient has then been triaged and invited into the service, the clinical team put on their PPE. The team consists of a nurse, Christina, doctor, Sonia, and medical student, Farah. And now, as you can see, the team are ready to go and meet the patient. So now the clinical team are going to leave the blue zone and enter into the red zone. There are signs up clearly marking this area, and the clinical rooms have been stripped from all but essential items. The door should be left open when not in use, and the window left open, and there's a good supply of oxygen. So this is the doffing area here, clearly marked, and in the doffing room there is a good supply of oxygen, along with emergency drugs and equipment, and pre-labelled packs of medication available for patients. So here we've got a clearly marked out area of 2 metres from where the patient is. So anybody entering into this direct patient contact zone knows that they have to be in PPE, and only does so if required. The nurse has checked the demographics, which the medical student can verify on the CAS card. And as she's recording the observations, these are called out to the medical student, who again records that onto the CAS card, which then directly corresponds to an EMIS template in the medical system. The doctor can then step forward and conduct her face-to-face assessment. At this point, she will have reviewed the medical records, including the double triage. In addition to the recorded OBS, the doctor will conduct any further clinical assessment and make a decision. So once the clinical assessment is completed, the clinical team can go back into the red zone and enter into the doffing area. If at any point during the clinical assessment, for any reason, the clinical team want to bring the patient into the building, there are obviously the clinical rooms available for this purpose. So as you can see, the taxi has been adapted especially for this purpose. The taxi driver will be using a mask whenever transporting patients, and the taxi itself is taken out of normal circulation and clearly identified as being used for patient transfer. Once the clinical decision is made by the clinical team, the patient can either go home with follow-up arranged with their own GP over the telephone, or with a supply of pre-labelled medications that we have on site here. If the patient is unwell, they can be transferred to hospital using the vehicle in which they came. So that would be typically the London Black Cab. If the patient is ambulatory, there's a dedicated hotline number, takes you through to the emergency team, where you then go into the main entrance of the emergency department. If the patient is more unwell, the Black Cab can actually go into the London Ambulance Bay and meet the receiving medical team there. In these circumstances, the clinician or the clinical team may decide to give the patient oxygen, and we have portable oxygen available on site that the patient can travel with to the hospital. This design helps to reduce the reliance on the London Ambulance Service at a time when it's under a particular strain. It also helps to reduce the need for home visiting, as a lot of these patients are frail and in need of shielding at the time. And also having had most of the clinical assessments done outside, this reduces the viral load for all staff working within the service. All staff working here come from local GP surgeries. This service has been mobilised at very short notice. There's a strong emphasis on team working within the whole service. And all staff are really enjoying the environment, enjoying working here, and feel confident and safe with the policies and procedures that we put in place. And all patients have reported that they're very satisfied. So only 1 week into running the service, the clinical team is increasing in confidence on how to deal with suspected COVID cases. They are sharing their learning and becoming increasingly confident in the use of telephone and video triage, where actually a significant number of the triages we are doing, we're able to deal with using those methods.
Hi, good afternoon. My name is Brenda Donnelly and I'm the clinical lead nurse here and a primary care network clinical director, and in a real privileged position to be here. Undoubtedly there'll be a new norm after this COVID pandemic, and what it's necessitated in our work is a rapid implementation of technology and integrated working. It's happened at mega speed. Ordinarily this would have taken us many years in primary care to implement. But what you can see here is the result of a real committed workforce. And we have had commitment from our CCG, from our federations, and most of all from my colleagues all around me. It's been an absolute joy. I have had the most amazing fun time and work that I've had for many, many years. We've had volunteers such as our medical students. We've had volunteers from our local population in terms of the visors that we can provide and the gowns. So this is population health in its wider sense. What we have is the right people with the right skills at the right time doing the right thing.